Let's talk about the NCLEX structure. Very important if you want to understand, right? I want you to follow this series because I will talk about the structure here. Another video, I will talk about another thing, right? But let me just introduce you to the structure. Every NCLEX question, right, have three structure, right? So the reason why the NCLEX want you to know this structure is because they are walking you through a process so that you can be able to make smart decision. One, they want you to have understanding, right? When you know the structure, right, you'll be able to create understanding, you'll be able to establish your role or know the action to take, and then three, you'll be able to make smart decision. So this is what the NCLEX is all about. Now, let us now identify the structure. We have three structure, right? Now, this is the first one, this is the second one, and this is the third one. Now, let me tell you the function. This is the body. Now, this body is for you. This is the stem. This stem is for what? The examiner. This is the answer keys, right? This answer key give you what? Extra understanding of what is going on. Now, a lot of students think about the answer key and immediately what they think about is selecting the answer. No, that is wrong. That's not what the NCLEX want you to do. The NCLEX want you to pick extra understanding from the answer keys, right? Before you now decide to select your answer. The answer key is sending you a message to create a certain critical thinking. That is the moment you start, that moment you go through all the answer key. That is when you start, right, critically thinking. You don't critically think right from the body. You don't critically think right from the stem. You start critically thinking when you have gone through the option to create that understanding. Every NCLEX question is written in form of a knowledge statement that want to be tested. So if you don't identify that knowledge statement in your answer key, you will be lost. That is the reason why you need to understand what? The NCLEX structure. Now, the body of the question, a lot of students start to think right from this place. No, the body of the question is just trying to tell you something. It's just like right now, if you use an iPhone, let us say you use iPhone 16, and I know you use iPhone 16, and I tell you you use iPhone 16. Are you going to be thinking about it that do you use iPhone 16? No, you already know you use iPhone 16. So that is what the body of the question is trying to tell you. The body of the question is trying to say, the nurse has taught a client about multiple sclerosis. What do you want to think right there? A lot of students start thinking about a lot of information. I'm asking myself, where are you getting those thinking? The body of the question just said, the nurse has taught a client about multiple sclerosis. Leave it as that. Your understanding right here is that a teaching has been done to a client about multiple sclerosis. All right, let us now wait for what the examiner is going to ask us, because this part is the examiner question that is going to ask us something related to the body. Now, you use an iPhone 16 and I ask you, you use an iPhone 16, right? And I said, I've seen iPhone 16 with you. There's no thinking right there because yes, you know you use an iPhone 16. Now, then I might not ask you question right now, and I say, what do you like about iPhone 16 better than iPhone 15? That's when my question can now come in and you start answering me, right? So the body of the question is not asking you any question, or the body of the question, which is this, is not telling you to overthink. It's just giving you a clue of what is going on. The nurse has done a teaching with a client with multiple sclerosis. That is for you. Now, the examiner is not going to ask you the question. The examiner is now asking you, which of the following statements by the client would indicate a correct understanding, right, of the teaching? That is what the examiner is asking you. Now, remember from the body, we identified that the nurse has done the teaching for clients who have what? Multiple sclerosis. Now, the examiner is now asking you that there's a statement that have been made. Now, which of those statements indicate correct understanding of the teaching that was done. So where are we going to find the statement? Obviously, the answer keys. The statement has been made. I see a lot of students at this point, they now start thinking, oh, I know we do so for a patient with multiple sclerosis. The NCLEX is not asking you to think about all that. The teaching is already right here. Just focus on the teaching and ask yourself, is this correct or wrong? Now, let's go over it again. Let me clean up. Let me clean up. We are talking about the NCLEX structure, right? And you need to understand it, right? You need to understand it. Now, let's go over it again. Now, this is the stem. I'm reading because this is not the stem. I mean the body. This is the body. I'm reading. The nurse has taught a client about multiple sclerosis. So this is the nurse right here, right? This is the client. The teaching has been done, right? So this is what I can identify right here, that the teaching has been what? Done. Now, the NCLEX is not telling me that statements were made by the client. Now, where are those statements? Obviously, right here. So the NCLEX is not telling you to immediately go select the correct answer. Instead, the NCLEX is telling you to review the statement to create a certain extra understanding. That's what the NCLEX is trying to test you, right? Now, what are the extra understanding we create? That is when you understand what we call the 6 NCLEX concept, because in each of your NCLEX question, NCLEX tests one of these concepts, and one of those concepts that the NCLEX test is teaching or learning. Now, this question is a teaching question. So now, when you are approaching a teaching question, you want to identify that you can either be teaching the patient, or is it that we are trying to teach the patient, or the teaching has already been done. Now look at the statement right here, taught. It means that the teaching has already been done. If the NCLEX did not use this and they just say teaching, it means that the teaching has not been done. Now, how do you approach teaching question? You approach teaching question by including what you are going to teach the patient. But for taught, right here, for this particular question that said taught, it means that we are not teaching no more. Instead, we are trying to evaluate the patient statement. So, but the thing in common when it comes to teaching or taught is that there's a certain problem that we are trying to talk about or has already been discussed. Now, we are now asking ourselves if the solution to that problem is what? Correct. So now when you are approaching any NCLEX question, it's not about the full statement. You are trying to look for what is the problem and what is the solution. And you are trying to ask yourself, is the solution correct? Yes, no, maybe. So you are not bringing any information to your NCLEX question. You are not bringing any information to your NCLEX question. You are only focusing on how the NCLEX wants you to answer the question. Now, I will repeat again, right? The NCLEX wants you to just understand simple principle, right? Starting from the structure. Now, if I'm to approach this question, the first thing I want to look at is what is going on, right? I want to look at what is going on. All right, the body of my question is saying the nurse taught a client about multiple sclerosis. Oh, okay. There's a teaching that has already been done to patients who have multiple sclerosis. Now, when there's a teaching that has already been done, what is the examiner asking me about a teaching that's already been done? Because I need to confirm what the examiner. You can see I did not think about anything. I only try to understand the body, right? A teaching has already been done. Now, the stem, which of the following statement by the client would indicate a correct understanding of the teaching. Now, the teaching has already been done. The NCLEX is wanting me to evaluate the client statement, and I'm looking for the correct understanding. Very important, because the NCLEX might tell you, look for the wrong understanding. But right now, the NCLEX is asking us to look at the patient statement, which the statements are right here, and then we are looking for correct understanding, right? So, yeah, this is the stem, which is the examiner question. This is the body. Now, I've been able to identify that. Now, this is the answer key. Now, look at how we approach the answer keys. Look at how we approach the answer keys. We approach the answer key not by looking for the answer, but we want to look for, because NCLEX is the concern. NCLEX concern is not every statement right here. NCLEX concern is just one key statement or one key sentence, right? So if you don't know that, it will be difficult for you to answer the NCLEX question. Now, let us figure it out. Now, because it's a teaching, right? The principle of teaching, we have 6 concepts. As I said, we have 6 concepts. If you don't know the 6 concepts, then okay, let me just share the 6 concepts, because you definitely need to know the 6 concepts. Now, the 6 concept NCLEX test: 1, they test caring; 2, they test nursing process; 3, they test clinical judgment; 4, they test communication and documentation, right? 5, they test culture and spirituality. 6, they test teaching and learning, right? So every NCLEX question tests this concept, because all these concepts all together test what? Safety, right? Caring, the NCLEX is trying to make you make smart decision, smart decision, smart decision, smart decision, smart decision. All those smart decisions keep the patient what? Safe. That's what the NCLEX is all about, right? So you need to follow through the structure. Now, understanding from this question, we can clearly see this is the teaching question. So I know it falls under this particular concept. Now, that is when you need to now use the principle of teaching and learning in order to answer the question. In order for this particular teaching to be done, there must be a problem. A patient have multiple sclerosis, there must be a problem that is going on with the patient, so we can teach them about what? The solution. So that is the teaching that would be done. So now, when the client is making statement, they will talk about the problem and they will talk about the solution that was taught. So the NCLEX is not trying to test us on the problem. Instead, the NCLEX is just trying to make us aware of the problem, and they are asking us if the solution that the patient is saying or the nurse is saying is correct. So that's the problem with a lot of students. When they don't understand the concept of the exam, they think about all the statements. That's the reason why they feel like everything look correct, or maybe, how will I say it? They feel like all the answers look correct or confusing. The NCLEX is not confusing. You don't understand the concept. That is the reason why you think about everything. The NCLEX is all about concept. So now, when you understand the principle of that concept, you are able to answer that question correctly. Now, the first step is to identify what? The problem. Now, because before a teaching need to be done, we need to know the problem. Now, this teaching has already been done, so we can also still find out the problem. Whether the teaching has been done or not, we can still know the problem. Now, I will complete, look at this statement, right? I will complete all my house chores in the morning when I am well rested. So I'm not thinking about it. Why did the nurse tell this patient about this particular statement? At this point, I am not thinking about if it is wrong or right. I'm only just trying, because the NCLEX is not saying this was not taught to the patient, this was not taught to the patient, this was not taught to the patient, this was not taught to the patient. The NCLEX is telling you that there's a particular problem that was discussed with the patient and a solution, and then the patient came up with this statement based on that problem. The patient came up with this statement based on that problem. The patient came up with this statement based on that problem. The patient came up with this statement based on that problem. Right? So we are trying to find out the problem so that we can be able to now ask ourselves if this solution the patient is talking about is appropriate to the problem. That's how we go about it. Now, it's very easy, right? Now, all you just need to do is what is the problem? Now, if I from reading number one, I feel these patients have an issue with what? Let me clear up the screen so it's very clear. Now, from reading number one, I feel like this patient is having an issue with stress. For this patient to make this statement, I will complete all my house chores in the morning when I am well rested. It looked like, why are you going to wait till when you are rested before you complete all your house chores? Maybe your house chores get you so tired, stressed. Now, I can identify that the teaching that was done in this question to this patient was all about stress. You can see the approach the NCLEX wants you to answer the question, because what you do is to be thinking about information. The NCLEX don't want you to think about anything. The NCLEX just want you to critically think through each options, not to bring more information to the question, because this is what we do. We attack our question with so much information that we have a lot going on in our heads and we cannot figure out the answer. The answers are already in the question. You just need to ask yourself, is this correct? Yes, no, maybe. But you need to understand the concept so that you know how to answer the particular question you are dealing with. Now, number two, from reading it, I have learned how to massage my bladder to help empty my bladder completely. The problem is very clear right there. It shows that the patient have issue with what? Emptying bladder. The problem is very clear right there. Now, the nurse said a lot of things about emptying bladder. Remember, we are trying to look for correct understanding, but the first thing we are looking for, what discussion did the nurse and the patient had? They had discussion about stress. They had discussion about emptying the bladder. Now, for those people that are very smart, that know about multiple sclerosis, at this point, you're already thinking about it. Oh, yes, a patient with multiple sclerosis have issues with stress. Yes, a patient with multiple sclerosis have issue with emptying their bladder. You can see the answers are already in the question. So why are you thinking about it? Because you are thinking about the wrong thing or wasting your time thinking because you don't understand how to answer NCLEX question. You still answer NCLEX question like you are answering nursing school question. So that's the problem. Because yes, stress is part of what happened to a patient with multiple sclerosis. And you can see it is right there on the question. So the NCLEX is not asking you to think about is stress what happened to multiple sclerosis patient. The NCLEX is not trying to make you think about is emptying the bladder a problem with multiple sclerosis patient. The problem is already there. The NCLEX is testing you on a certain concept of teaching and learning. Teaching and learning don't make you think about what is the problem with the patient. There's a problem and solution has been given to the patient. So are they thinking about the correct solution to the problem? But you need to identify the problem before you think about the solution. Right? I cannot just start thinking about solution when I don't know the problem. You understand? So now, look at the other one. I will take a hot bath in the evening to help me relax if I have had a stressful day at work. Obviously, look at it right here. It's talking about stress. This one is talking about rested, it's also stress. So now, this patient have issue with stress. 2 times the nurse gave them discussion about stress, the stress with resting and stress with work. Right, the first one is about resting, the first one is about work. So 2 issues about stress right there. Now the other one is I should expect the blur vision to resolve after I receive my medication for several weeks. Obviously, look at the problem right there. This one is right there. So they have issue with blur vision. Now, I know smart students are not saying, oh wow, so I don't even need to think about what is wrong with the patient with what is wrong with the patient who have so condition. It means that the problem is already in the question. So if the thinking is not me figuring out what is the problem. So what is the thinking? Oh, it means that it's the solution to the problem because the NCLEX have the problem already in the question. Remember, this is nursing care. You cannot treat a patient if you don't know what is going on. You cannot treat a patient if you don't know what is going on. So you cannot expect the NCLEX to give you a question without not telling you what is going on. The moment the NCLEX don't tell you what is going on, the NCLEX is trying to send you a signal that we are testing you on nursing process whereby you need to start with what? Assessments. The moment you don't know what is going on, the nursing thinking is that let us assess to find out what is going on. Now, we don't need to do any assessment right here because one, we know what is going on and teaching has been done based on what is going on. And we are teaching the patient based on what? Their problem, and we have given them solution. So now this is a teaching question that has already been done. So it's expected for the NCLEX to ask correct understanding or wrong understanding. Right. So now when the NCLEX asks about correct understanding, it means there are three wrong understanding in this question and just one correct understanding. But now we've been able to identify the problem. So now what we are thinking about is what? The solution, right? I just want to clear everything up. Now, so what we are thinking about right now is the solution. We've been able to identify our problem. Now, what is the solution the patient is talking about right here? Now, the patient is saying they are going to complete all their house chores in the morning, right? In order to what? Avoid the stress. Now, the patient is saying they will massage their bladder in order to empty the bladder. The patient is saying they will take hot bath. That's the solution in order to manage the stress. The patient is saying they will take their medication for several weeks in order to manage the blood vision. So this is the point. This is the point at which the NCLEX is asking you to say, is this true? Yes, no, maybe, right? Normally, the NCLEX is all about yes, no. I included this myself because sometimes we spend more time in a certain option because we cannot really think fast. So we tend to delay in that particular option. So if you are not really thinking about your answer, just put maybe in front of it and come back to it later. Right. So now, I will complete all my house chores in the morning. Now, it is stress. Now, a patient that is having stress, I expect them to rest, right? And they are talking about resting. Yes, that's a good thing. Now, resting will not cause you stress. Activity will cause you stress. Now, they are doing a particular activity right here, which you can see they are doing a certain activity. I will complete my house chores in the morning. Now, completing house chores in the morning, as a nurse, you need to evaluate how do they want to complete it. Are they trying to evenly distribute it or they are trying to do everything at a time? Now, the NCLEX is about three things. The NCLEX wants you to think about three things when you are looking at your answer. The NCLEX is trying to think about bad action, bad nursing action. Let me put nursing right here. Okay, let me just clean it so I can just write it. The NCLEX wants you to think about bad nursing action. The NCLEX wants you to think about absolute that make answers wrong, right? And the NCLEX wants you to think about might not be applicable to the situation of the client. Right. So now let's follow this principle. Bad nursing action. Right. Let's follow this principle. Now, is there absolute here in number one? Obviously, yes, there's absolute. And where's the absolute? This is the absolute right here. All. Now we are trying to avoid stress. And the client is saying they will do all their house chores in the morning. That is going to give them more problem because you've rested and you are going back to doing all activity again. You are still going to be stressed again. That is not how to manage your stress. You need to evenly distribute the house chores, maybe doing some in the morning, afternoon, and night. So absolute make this option wrong. Now, so that's not good intervention. Yes, we want them to rest, but coming back to do all their house chores in the morning when they can evenly distribute it, make it wrong. Right? So Absolutely make that wrong. Now, massage my bladder. Yes, it's a good intervention. Yes, we massage bladder. There's one medical word that we use for that. We call it the cradle. I don't know whether it's the cradle maneuver, right? So we do that. So yes, it's a good thing to do. So yes, this is like a yes answer right there. Now, hot bath. That is a bad action. Is it that going to be a bad action or bad nursing action? It's a bad action. We don't do hot. In nursing, we do warm or cool, not hot. Hot is red flag. So this is wrong. Even if we want to manage the stress by taking a shower, we don't do hot because you don't know the level of hotness. It could be a problem, right? So we do warm. It should be warm, right? Or cool. So that's wrong. Now, the issue right here is blood vision, and they are saying they are going to get their medication to solve the blood vision, right? Now, the NCLEX want you to see if it's maybe there's absolute is a bad action. It's not bad to use medication to solve a problem. It's not a bad action. There's no absolute right here because they said they should use their medication. No absolute is applied right there. They might say, okay, maybe situation like use your medication just once or use your medication when your problem has been resolved. All those answers are wrong because we expect the patient to use their medication for the period of time that it was prescribed, not when their condition has been resolved. When their condition has been resolved, we still expect them to continue using the medication till they are done with the medication. So that will make it wrong. And we are not seeing anything like that right here in the answer key. So bad nursing action, absolute is not applied. What we are thinking about is if this answer is applicable to the patient situation. Now, what is the patient situation? Multiple sclerosis. The NCLEX wants you to understand three things when you come to medical condition or your med surg, as we talk about, as you people do talk about it. Now, the NCLEX wants you to understand one, is the medical condition acute or chronic? The NCLEX wants you to understand the body system affected, the body system affected, and the NCLEX wants you to understand what? The pathophysiology. So these three things, that's what the NCLEX wants you to understand for every medical condition. Is it acute? Is it chronic? This is chronic, right? What body system is affected? The neuro. Pathophysiology, obviously, you know there's a myelin tissue, right? So that is it. Now, but we can be able to answer this question based on all these particular statements, right? Now, when we understand that this is a chronic condition, we can be able to now say, since this is a chronic condition, do we expect when we have a chronic condition for medication to resolve complication? For acute condition, if there's a problem, yes, we expect medication to resolve acute condition. But for chronic condition, if there's a problem, we don't expect medication to resolve it. If there's a complication, right? We don't expect medication to resolve it because complications that happen with a chronic condition, be it multiple sclerosis, diabetes, hypertension, Alzheimer's, any kind of chronic condition, when there's a damage or a complication that occur, we don't expect medication to solve it, right? Or maybe to reverse it or something like that. So understanding that this is a chronic condition, this as well too will not be applicable, and then we'll be left with what? Number two as the correct answer to the question. Now, if you follow through by starting with the structure and as well to following through by starting with everything that I have said in this video, trust me, you'll be able to answer the NCLEX question the smart way, a way that you understand what needs to be done and be able to answer the question with clarity, right? Than the way you overthink about a lot of information and then you get the answer incorrectly, or you are lost, you are thinking there's more than one answer, the question is tricky. The NCLEX is not tricky. You just need to understand the concept used. You just need to understand the concept. You need to understand the concept and the principle the principle attached to each of those concepts, right? You need to understand the structure so that you can be able to navigate through the body, stem, answer keys. Then what concept is the NCLEX testing? Obviously, teaching. And then understanding the teaching concept, you need to apply the principle. The teaching concept include the condition, the problem, and the solution. So the NCLEX can either test you on teaching or thought. Thought means that the teaching has already been done. Teaching means that the teaching has not been done. Now, for this, the NCLEX might say, what would you include in the teaching? What would you include? Thought will be to evaluate the patient's statements, be it correct statement or wrong statement. But teaching, what are you going to include in the teaching plan? So what you will include in the teaching plan based on the problem you identify and the solution. But guess what? The problem is already in the answer keys, such as this. You don't need to start thinking about the problem. The statement as well too. The problem is already in the answer keys, such as this. You don't need to think about the problem. Your NCLEX goal or thinking is to critically think about the solution. Is it appropriate? Right? And you are thinking about the solution if it's appropriate based on 3 core principles, right? That apply to your 85 to 150 question. Because every student have 85 to 150 question. You can either pass in 85 question or pass in 150 question or pass in between 86 to 149 question. Now, every of your question, you need to follow this critical thinking. Is it a bad action for the patient to take or a bad action for the nurse, right? This can be for the client, bad action for the client. Now, your second thinking is, do we have any absolute that is going to make that answer wrong? Absolute like never, all, every, you understand? Never, all, every, always. These are absolute that can make an answer wrong, right? And then 3, you are thinking about might not be applicable, right, to the patient's situation, right? Situation going on with the patient, it might not be applicable, right? So these are things you definitely need to know, and you'll be able to kill the NCLEX exam. So this is where I'm going to stop this video. If you watch this video multiple times, take your notes, use this same concept to practice more questions. Not only practicing questions that involve teaching, you can practice other questions as well too. And guess what? You'll be having clear understanding about most things, and you'll be able to succeed on the NCLEX exam.